Hello and welcome to this edition of KTN Africa Speaks. Today is the 6th of September 2014, and today would like to put most of our attention on the current health status on the African continent. Now, many diseases are regularly found or are endemic in Africa and often prove fatal when they're not treated quickly and efficiently. Diseases such as malaria, tuberculosis, and HIV and AIDS, as well as sleeping sickness, seem to be specific to Africa. Malaria is widespread and kills one African child every 30 seconds. It is the leading cause of death among under fives in many African countries, and today Ebola has killed over 1,900 people in the worst outbreak in history, and yet continues to spread beyond West Africa. Access to medical facilities, from drugs to equipment, is unheard of in some parts of Africa, and some people don't even know what hospitals look like. The cost of medication is not affordable to all, and according to UNFPA, every minute a woman dies in pregnancy or childbirth. And the risk of a woman dying in sub-Saharan Africa as a result of pregnancy or childbirth is 1 in 22 as compared to 1 in 7,300 in developed countries. Now, in sub-Saharan Africa, about 70% have no contact with health personnel following childbirth. And these are some of the challenges that Africa continues to face. And Africa's healthcare systems are at a critical turning point. The reforms that governments undertake over the next decade could be crucial to cutting mortality rates and also improving health outcomes on the continent. Despite a Maputo agreement where African countries signed to allocate 15% of their national budgets to health, only 4 African nations, that is Botswana, Burkina Faso, Malawi, Niger and Rwanda, as well as Zambia, have met this commitment. Health experts now believe that even if the target is reached, 15% of a small budget is not sufficient to make major inroads into poor health. 4 of the 6 countries allocating 15% of their budget still only spend $14 per capita on health. Now, where have we gone wrong on health? Have policymakers failed us as a continent, and what progress is being made to improve health services as well as facilities across Africa? Joining me in studio is Dr. Lenny Chomhanji Bazida, who is the country director for Kenya Amref Health Africa, and Dr. John Duba, who is the health program director, Amref Health Africa headquarters, and they're here to talk to us about matters health across Africa. Welcome all to Africa Speaks. It's such an honor to have you in studio.
Thank you so much, and good afternoon, viewers.
Well, it's very appalling when you look at the statistics when it comes to health and just how badly an African continent could be doing, knowing that we have almost the largest population across all the other continents around the world. So I'll start with Dr. Chomhanji. Where exactly have we gone wrong when it comes to health?
Okay, I'll just start by saying, Joy, that we have made some progress as Africa. So, but however, having said that, there are so many other things that we have not done right. We still have people dying from what you call preventable causes. And in Africa, the most affected are women and children. And the main condition that could have prevented is issues of maternal newborn. Women dying while giving birth and children dying because they cannot be saved. And of course, the main infectious diseases, especially HIV, TB, and malaria. Now, when you look at those, they are all preventable. Where have we gone wrong? I think the first one I will mention, as somebody who has been working in the health sector in Africa, not just in Kenya, but in other countries, I will start with financing. You did mention that the percentage of the budget that is allocated to health, we have not met the Maputo Declaration. But even then, the healthcare financing, when you look at Africans, in Kenya inclusive, very few people have health insurance. So the health sector is not funded adequately. That is the public sector. Even the private sector really is very small compared to the population. And then I'll go ahead and mention that in terms of prevention, there are solutions that could work, and I believe we'll come to that, but the focus should be on the communities, the people knowing what is wrong, improving the health-seeking behaviors. We have not addressed that. And then we still have a lot of inequities in Africa. Actually, you will find that there's still a very small population whereby the things you mentioned actually are not happening. They have access, they have good health care, but then we have a larger part, more than 80%, whereby the inequities are very evident. So I think where we have gone wrong, though we have programmed our health services, it's not inequitable in terms of accessibility, in terms of funding, in terms of human resources for health. We do not have enough doctors, we don't have enough nurses, and even when we have them, the distribution is skewed toward the urban centers and less to the rural sectors.
Right. I'll now go to Dr. John Nduba, who is the Health Program Director for AMREF Africa. And from your own perspective, do you think that African countries have neglected the health sector?
I wouldn't call it neglect. I want to focus on a slightly different area from the things that Lenny has spoken about. I want to talk about health systems in Africa. Key to health systems performance are really some of the basics of performance in any sector. They include leadership. They include human resources. They include a political will to change things. And I think most importantly for Africa, they include things that are relevant, systems that are relevant and applicable to the problems of the region where we are trying to address those problems. And I can assure you that there are many things wrong in all those things I've mentioned. Looking overall at Africa's health system, we recognize that it was mostly copy-pasted from health systems developed elsewhere. And often those health systems were created to address the needs of a few people, the urban elite. And in our own way, we are responsible for our status because we have continued along that path. Rarely have Africans got together to discuss the relevance of the systems that they use to try and address problems like health problems. And so typically, we struggle to control malaria. Our population remains largely uninvolved, uninformed. We do not put quite enough money, as Lenny has pointed out, in those systems. And we don't have correct human resources balance. We train a few very high-level people at great cost. We run a few very costly hospitals. Literally in every region you find we want a regional hospital, we want a district hospital. Is this still relevant for Africa, or can we fund our systems so that they are more relevant to African needs? Clearly, the focus for us must be on African communities as we continue to discuss what works for Africa.
Right.
If people are not informed, they can't make the right decisions.
And in this case, because we seem to see a generation, or at least citizenry across Africa, that don't even know what their health rights are, and that probably is one of the biggest challenges. And so I would like to find out, what are the basics that every African citizen is entitled to when it comes to health? I think I'll pose this question to Dr. John Nduba.
Yes. It's interesting that you bring up the question of rights, because health is a human right. And the poor health status of Africans does tell you something about the range of human rights that Africans enjoy. But that's a larger debate than health. Let me just say that the beginning point for us must be that Africans must begin taking charge of their situation. And that means us educating our populations to understand not only their rights to health, but their rights as human beings, their right to be heard, their right to have a voice. When you have a voice, then you can demand what your right is, and one of those things is health. Many of us do not think of anything when a woman dies in a village. We don't ask, why is this happening in the 21st century? I think maybe you're very right, that is the beginning point. Africans must begin to demand their rights, not only as human beings, but as citizens of this continent.
Well, the most affected people, Dr. Lenny, that we have who are affected maybe by the fact that they don't have access to health or don't even know their rights, happen to be the people who live in the rural parts of Africa. How best can we reach out to those people, knowing that they don't have any knowledge or any education, that look, they are entitled to the basics of health, and also making sure that they have just as much as the people who live in urban areas have?
I think the best thing to do is what we call community health system strengthening, and that is educating the people. Whether they've gone to school or not, is really having approaches that can work, that you can actually go from household to household and talk to them. And then you start by just letting them know what are their rights, what services should they expect when they go to a facility. But not just that, what should they expect from their leaders, the politicians? I think the mistake we have made, we have verticalized health. But health cannot stand alone. It is issues of governance and leadership. When you have your political leader that you have voted for, as somebody down there in a village, what should you demand from him? Okay? For example, we have said it's mostly women and children, the uneducated, the ones who are hard to reach and marginalized communities. However, even though they are hard to reach and marginalized, they all know that a woman should give birth, she should live, and her baby should survive.
Right.
They all know that when you're sick, you should be able to access services. They all know that actually you need access to safe water. And I think that's why I keep saying that we need to educate them. What is health? When you talk of health, people ask you, what do you mean by health? First of all, they have to understand that. When you talk of prevention, like most of the, I think at the community level, even knowing that we can never have enough funding to meet all the health needs, let us focus on the prevention. And that's where the people come in. Talk to them about eating right, drinking safe water, seeking services as soon as you feel like you're not feeling well, going for antenatal care, the basics that you can talk to a woman or a man in the most rural part of Africa. That is the basic we can do. How do we do it as Africans? We have to focus on the community, educating the community, working with civil society organizations, working both the public and the private sector, and with all the leaders. And then, lastly, I think, really in Africa, we cannot do away with our beliefs. There are traditional and cultural beliefs that stop people from seeking services, even when they know they're supposed to get it. Right. So we have to focus on how do we deal with our traditional beliefs without doing it with our culture, where we come from, but how do we ensure that within those traditions and beliefs, we can at least ensure that people have access to quality health services.
Right, and speaking of cultural beliefs, Zimbabwe apparently has 45,000 traditional healers and just 1,400 medical doctors, according to statistics from 2010. Now, that should actually explain just how much interested we are in our own health and the kind of treatment we prefer to go for. But we'll now take a short break, and when we return, we'll also be reading out some of your responses on where you think Africa has gone wrong when it comes to health. Our hashtag today is Africa Speaks. We are discussing health in Africa and where has Africa gone wrong when it comes to health. We're using the hashtag Africa Speaks. In studio, we are speaking to Dr. Lenny Chomhanjibazida, who is the country director for AMREF Kenya, or AMREF Africa, but then the Kenyan chapter. And we also have Dr. John Duba, who is the Health Programming Director for AMREF Africa headquarters. And they're here to, tell us what exactly we are doing wrong and also how we can address the challenges that we are facing as an African continent. Many times we've heard that most of our health workers have gone outside of the continent to look for greener pastures. And that is why we are seeing about, 1,400 health workers in countries like Zimbabwe, and we're also seeing maybe one doctor having to treat over 700 patients, and that ratio there is quite very wanting. When you look at the deaths compared to developed world's deaths, you actually get more worried, And especially knowing we are in the 21st century yet still experiencing these same challenges, do you think that politics or concentration on politics has also affected the health sector? You can tell us about that. Now let's take a look at some of your responses. We're having at Extreme Kenya is saying some African beliefs are a barrier to health development, and Abel Momanyi is saying we are our own enemy. Crucial learning is actually one of the biggest challenges that we have. And Gina Dean is saying Africans must take charge of their rights to health. Those are some of the responses coming through. And you can keep the hashtag Africa Speaks. Where have we gone wrong when it comes to health? What is the worst experience you've had in trying to access health facilities or even health treatment for that matter? I would like to bring you in, Dr. Lenny, from the perspective of women and health. Child mortality rates are so up there. When you look at the number of deaths that we have of children who are under 5, it's actually very disturbing to see that at least they say, according to statistics from UNFPA, every 30 seconds a child is dying either during birth or at least before they turn the age of 5. And that is very disturbing for most people who live on the African continent. But how exactly can we address the issue of women and health as well as children?
I think the issue of women and health, I think I will start from the basics. We need to educate women. We have said health is a right, but women in Africa, and myself being a woman, really when you look at most women, they don't know their rights, starting from the household. Sometimes the woman can act, even if when she knows she should go to the hospital or she should take her child, she cannot go unless the husband allows her to or provides the money. And so one of the solutions we should start with, we need to have economic empowerment of women. Because you educate a woman, she's able to make decisions, and then you empower her, then she can seek the services. But then again, we need to start from the pregnancy. Family planning. How many women have access to family planning? Even when they know they should have it, how many of them are able to make the decisions? In most African cultures, unfortunately, because of how we are structured and our beliefs, the woman does not make the decision. Or the community will look at you, if you have fewer children, or maybe you have one sex over the other, you have to keep giving birth, and the more you give birth, the more dangerous it becomes. When it comes to children under 5, we start for infant mortality when they are born, within the first few weeks of being born. If they are being born at home, the chances of them dying before they even reach 1 month are higher. So that means we need to increase what we call skilled birth attendants. The challenge we have in Africa, in most of the, especially the rural areas, the distance to the nearest health facility is too far. And then the roads, that's why I keep saying we cannot look at health without looking at the other sectors.
Right.
When there are no roads, they cannot get there. When there's no transport, she cannot get there. When she gets the facility, is there water? Will she be able to take a bath after giving birth?
Right.
When she takes her child who is under 5, when she has no clothes for him or he's dirty, she will feel ashamed.
Right.
So she will not go.
Dr. Nduba, I would like to hear from you. At the moment, we are experiencing one of the worst health disasters across the African continent, and that's on Ebola. West Africa has been worst hit by this outbreak, and that seems to be the worst in history. But knowing that we have these challenges at the moment, and knowing that we are an African continent that is struggling even with medical research, how exactly can we address the medical challenges that we have today?
That's a really huge question, of course. But let's break it down into component parts. You talked of Africans having many beliefs that endanger health. The Ebola epidemic demonstrates that more than anything else. You've heard that in some of the countries, health workers are being chased away from communities when they are trying to educate people. They're seen actually as the danger, like they're bringing Ebola. They're going to traditional healers. And this brings us to a very clear fundamental. The access to information and knowledge for people and communities. And that is why AMREF talks about community systems. There must be a focus on getting our people to have the most basic understanding of things like hygiene, how disease is transmitted, how it is mitigated, and so on. That is really the beginning, and it begins in the family. Our focus in training health workers requires reorientation, where health workers see themselves not as only medical care providers, but also as educators of communities.
Educators of communities. And, you know, there's the AMREF Health Africa International Conference that is coming up, that is going to be on the 24th to the 26th of November 2014. And it's also going to focus on from evidence to action, lasting health change in Africa. We are out of time, but in just a split 30 seconds, what do we expect to gain out of this conference?
We want as Africans to bring stakeholders together to discuss this crisis of health in Africa. We hear people from everywhere telling us what should happen in Africa. We as at AMREF think that it is time Africans started dictating their own agenda, how to address their health challenges.
Right.
Because if we don't do that, we will remain the continent with the poorest health status.
Great. And for that, we will actually be also focusing on financing healthcare development and also the post-MDGs. Unfortunately, we are out of time, but I do appreciate the time you've taken to come on the show to tell us about the current health status across the African continent. Dr. Lenny Chomhanji Bazida, who is the country director for AMREF Africa Kenyan chapter, and also Dr. John Nduba, who is the health programming director for AMREF Africa headquarters. Thank you both for joining us on this edition of Africa Speaks. My name is Joy Doreen Bira, the hashtag Africa Speaks. Well, do stay with us on KTN, and until the next edition, good afternoon.
Thank you.